After 60, many seniors take supplements faithfully, yet still feel tired, weak, unsteady, or mentally foggy, without understanding what their bodies are truly missing. Doctors increasingly see a troubling pattern where common symptoms are not caused by disease, but by silent vitamin and mineral deficiencies. What makes this especially dangerous is that these deficiencies often develop slowly and rarely show up clearly on routine blood tests. Many seniors assume eating less or having a smaller appetite is normal aging, not realizing it quietly reduces nutrient intake every single day. At the same time, aging digestion absorbs nutrients less efficiently, even when the diet appears balanced on the surface. This creates a hidden gap between what seniors think they are getting and what their cells actually receive. Deficiencies do not announce themselves loudly. They whisper through fatigue, muscle weakness, balance issues, poor sleep, and declining immunity. Doctors often notice these patterns long before serious conditions like fractures, falls, or cognitive decline appear. After 60, the body's margin for nutrient error becomes much smaller than it was decades earlier. Small shortages that once caused no harm can now trigger significant physical and neurological changes. Many seniors believe taking one multivitamin covers everything, but that belief is often incomplete or misleading. Different vitamins and minerals serve very specific roles that a general pill may not adequately supply. Some nutrients are depleted faster with age, medications, or chronic stress, increasing risk without obvious warning signs. Others require precise timing or combinations to be absorbed properly after 60. Doctors see patients surprised to learn they are deficient despite eating healthy and taking supplements regularly. These deficiencies quietly affect bones, muscles, nerves, circulation, and even mood. Understanding which nutrients matter most after 60 can dramatically change how the body feels and functions daily. Today, we're going to uncover the most important vitamins and minerals many seniors are lacking right now. This is not about fear or chasing pills, but about understanding what the aging body truly needs. Before we begin, tell me how old you are and where you're watching from, and let's learn together how to support health after 60. To make sense of these silent deficiencies, let's take a closer look at the specific vitamins and minerals doctors most often find lacking in adults over 60 and why they matter so much. Number 1. Vitamin B12 supports brain and nerve health. Vitamin B12 is one of the most critical nutrients for seniors because it directly supports brain function, nerve signaling, and the production of healthy red blood cells. After 60, many people absorb vitamin B12 poorly due to reduced stomach acid and lower intrinsic factor, even if their diet seems adequate. This means seniors can be functionally deficient even when blood tests appear borderline normal or acceptable to most clinicians. Low vitamin B12 quietly affects the nervous system, leading to tingling, numbness, burning sensations, or balance hesitation that often worsens at night. It also plays a central role in memory, attention, and mental clarity, making deficiency easy to mistake for normal cognitive aging. Doctors frequently see seniors complaining of brain fog or forgetfulness that improves once B12 status is properly addressed. Vitamin B12 is essential for maintaining the myelin sheath, the protective coating that allows nerves to transmit signals efficiently and accurately. Without enough B12, nerve signals slow down or misfire, causing subtle neurological symptoms long before severe damage appears. Fatigue is another common sign because B12 deficiency reduces oxygen delivery by impairing red blood cell formation. Many seniors feel weak or short of breath without realizing the problem originates at the cellular level. Certain medications after 60, including acid blockers and metformin, further reduce vitamin B12 absorption over time. This makes long-term users especially vulnerable to gradual deficiency without obvious warning signs. Unlike some vitamins, B12 deficiency can progress silently for years before symptoms become unmistakable. By the time walking feels unsteady or hands feel numb, damage may already be advanced. Early awareness is crucial because nerve damage from prolonged deficiency can be slow or incomplete to reverse. Doctors emphasize B12 because it affects both physical stability and cognitive independence after 60. Supporting adequate B12 helps protect memory, coordination, and confidence in daily movement. It is not about megadoses, but about proper absorption, timing, and consistent availability to nerve tissue. Many seniors are surprised how much better they feel once B12 needs are truly met. This is why doctors consider vitamin B12 one of the most important nutrients to evaluate and support after 60. Number 2. Protein. Builds and maintains muscle strength. Protein is especially important after 60 because it provides the essential building blocks muscles need to stay strong, stable, and responsive during everyday movement. As we age, the body becomes less efficient at using protein, meaning seniors require higher quality intake just to maintain the same muscle mass. Many seniors unknowingly eat too little protein each day, even when they believe their meals are balanced and sufficient. Reduced appetite, dental issues, and fear of weight gain often lead to protein being slowly removed from daily meals. Without enough protein, the body begins breaking down muscle tissue to meet basic metabolic needs. This muscle loss happens quietly, first affecting legs, hips, and core muscles critical for balance and walking safety. Doctors often see seniors who walk daily but still lose strength because movement alone cannot replace missing protein. Protein is required to repair muscle fibers stressed by simple activities like standing, climbing stairs, or carrying groceries. When protein intake is low, recovery from daily strain becomes slower and weaker over time. This increases fall risk and reduces confidence in movement, even before noticeable weight loss occurs. Protein also supports immune function, helping seniors recover from illness without prolonged weakness or muscle wasting. Low protein intake is linked to slower wound healing and longer recovery after hospitalization or minor injuries. Many seniors rely heavily on carbohydrates for energy, not realizing carbs cannot preserve muscle tissue. Spreading protein evenly across meals improves absorption and muscle response after 60. Doctors emphasize protein because it directly supports independence, not just physical appearance or body weight. Even small increases in daily protein can significantly improve strength over several months. Protein quality matters, with whole food sources generally supporting muscle better than highly processed options. Adequate protein helps seniors feel steadier, stronger, and more capable during everyday routines. Maintaining muscle is not about building bulk, but about preserving function and safety. That is why protein remains one of the most important nutrients for maintaining strength and independence after 60. Number 3. Vitamin D strengthens bones and boosts immunity. Vitamin D becomes especially important after 60 because it regulates calcium absorption, supports bone density, and helps muscles function safely during daily movement. As skin ages, its ability to produce vitamin D from sunlight declines sharply, even in seniors who spend time outdoors regularly. Many older adults assume sunlight is enough, yet blood tests often reveal low vitamin D levels despite frequent outdoor exposure. Low vitamin D weakens bones quietly, increasing fracture risk long before osteoporosis or bone thinning is officially diagnosed. It also affects muscle strength and coordination, making balance less stable and increasing fall risk in everyday situations. Doctors frequently see seniors with unexplained falls who later discover chronic vitamin D deficiency contributed significantly to muscle weakness. Vitamin D plays a vital role in immune regulation, helping the body respond effectively to infections and control inflammation. Deficiency is linked to more frequent illnesses, slower recovery, and lingering fatigue after common infections. After 60, vitamin D receptors in muscles and immune cells become less responsive, increasing the need for adequate circulating levels. Certain medications, including steroids and acid blockers, further interfere with vitamin D absorption and metabolism over time. Low vitamin D is also associated with low mood and reduced energy, often mistaken for normal aging. Because symptoms develop gradually, many seniors remain deficient for years without obvious warning signs. Doctors emphasize vitamin D because it supports both skeletal strength and immune resilience simultaneously. Adequate levels help muscles contract efficiently, improving posture, balance, and confidence while walking. Bone maintenance depends on steady vitamin D availability rather than occasional high doses taken inconsistently. Timing and consistency matter more than megadoses when correcting deficiency after 60. Blood testing often reveals deficiency even in seniors who eat well and stay physically active. Correcting low vitamin D can improve strength, immunity, and overall vitality over several months. This nutrient quietly influences many systems that determine independence and physical safety. That is why vitamin D is considered a cornerstone nutrient for healthy aging after 60. Number 4. Vitamin C helps immunity and healing. Vitamin C is especially important after 60 because it supports immune defense, tissue repair, and protection against oxidative stress that increases with aging. As people age, chronic inflammation rises, increasing the body's daily need for vitamin C to protect cells from ongoing damage. Many seniors consume less vitamin C due to reduced fruit intake, digestive sensitivity, dental issues, or limited access to fresh produce. Vitamin C plays a key role in collagen production, which is essential for healthy skin, blood vessels, joints, and connective tissues. Low vitamin C can slow wound healing, causing minor cuts or bruises to take much longer to recover in older adults. Doctors often see seniors with delayed healing who are surprised to learn their vitamin C intake is consistently inadequate. This vitamin also supports white blood cell activity, helping the immune system respond faster and more effectively to infections. Deficiency may lead to frequent colds, prolonged illness, or lingering fatigue after recovery from common infections. Vitamin C helps regenerate other antioxidants in the body, amplifying overall cellular protection against daily stressors. After 60, absorption efficiency may decline, increasing the risk of functional deficiency even with moderate intake. Smoking history, chronic stress, and certain medications can further deplete vitamin C levels over time. Because symptoms are subtle, many seniors remain unaware of low vitamin C status for years. Adequate vitamin C supports healthier blood vessels, improving circulation and oxygen delivery to tissues. It also helps reduce inflammation, supporting joint comfort and mobility during daily activities. Regular intake is more effective than occasional high doses taken inconsistently. Whole food sources provide additional phytonutrients that enhance vitamin C's protective effects naturally. Doctors emphasize vitamin C because it supports resilience during illness and recovery after 60. Improving intake often leads to better energy, faster healing, and improved immune confidence. Vitamin C does not work overnight, but strengthens the body steadily with consistent daily support. That is why vitamin C remains a foundational nutrient for immunity and healing in adults over 60. Number 5. Omega-3 protects heart and brain. Omega-3 is critical after 60 because it supports heart rhythm, reduces inflammation, improves blood vessel flexibility, and helps protect brain circulation and function overall. Many seniors are deficient in omega-3 because aging reduces absorption, diets change, and fewer people regularly consume fatty fish or quality sources consistently daily. Omega-3 fats, EPA and DHA help lower triglycerides, reduce clotting tendency, and calm chronic inflammation that quietly damages arteries and brain tissue over time. After 60, inflammation becomes a major driver of heart disease, stroke risk, and cognitive decline, making omega-3 protection increasingly important daily for aging bodies. Omega-3 also supports brain cell membranes, improving communication between neurons and helping preserve memory, attention, and processing speed with aging in older adults daily. Low omega-3 levels are linked to depression, mood instability, and faster cognitive decline, symptoms often misattributed to normal aging in older adults today worldwide. Doctors emphasize omega-3 because it protects both cardiovascular and neurological systems simultaneously, offering broad benefits beyond single symptom relief for seniors after 60 years. Omega-3 improves blood flow by reducing platelet aggregation, helping keep blood less sticky, and supporting healthy circulation to vital organs throughout the aging body. This effect becomes especially important after 60 when blood naturally thickens and vessels stiffen, increasing clot risk without obvious warning signs during daily life activities. Omega-3 may also improve balance and reaction time by supporting nerve signaling and reducing inflammation within the nervous system in older adults after 60. Many seniors take fish oil incorrectly, using low-quality products or inconsistent dosing that limits omega-3 effectiveness over time for heart, brain, and circulation. Doctors recommend omega-3 from whole foods or purified supplements tested for contaminants, ensuring safety alongside cardiovascular benefits and brain support in aging populations worldwide. After 60, omega-3 works best when taken consistently with meals containing fat, improving absorption, and reducing digestive discomfort for seniors over long-term use. It is not about megadoses, but about regular intake that steadily supplies cells with anti-inflammatory building blocks needed for repair, protection, and resilience daily. Omega-3 cannot replace medication when needed, but it supports foundational biology that medications alone often cannot restore fully in aging hearts, brains, and vessels. Many seniors notice improved joint comfort, steadier mood, and clearer thinking after correcting omega-3 deficiency gradually over weeks or months of consistent intake daily. Because benefits build slowly, omega-3 requires patience and consistency, rather than expecting rapid dramatic changes in energy, circulation, cognition, or balance immediately after starting. Doctors value omega-3 because it addresses underlying inflammation, a root contributor to many age-related conditions affecting seniors' hearts, brains, joints, nerves, and vessels. Adequate omega-3 intake supports healthier aging by protecting systems that maintain independence, confidence, and daily functional ability in older adults after 60 years old. That is why doctors rank omega-3 among the most important nutrients seniors should not overlook after 60 for heart, brain, and circulation health daily. Number 6. Calcium reinforces bone structure. Calcium becomes critical after 60 because it reinforces bone structure, supports muscle contraction, and helps prevent fractures that often follow minor falls in older adults. As aging accelerates bone loss, inadequate calcium intake quietly weakens the skeleton, increasing fracture risk long before osteoporosis is formally diagnosed by doctors worldwide today. Many seniors consume less calcium due to smaller appetites, dairy avoidance, digestive discomfort, or confusion about conflicting nutrition advice over many years of later life. Calcium works closely with vitamin D and magnesium, meaning deficiency rarely occurs alone and often reflects broader mineral imbalance after 60 in older adults today. Without adequate calcium, bones become porous and fragile, making hips, spine, and wrists especially vulnerable to breaks from simple daily movements and minor accidents alike. Doctors often see seniors surprised when scans reveal significant bone thinning despite feeling strong and active during everyday routines, at first glance initially outwardly healthy. Calcium also supports proper muscle contraction, helping prevent cramps, weakness, and sudden instability that can trigger dangerous falls during walking, standing, turning, or daily movement. After 60, the body absorbs calcium less efficiently, especially without sufficient stomach acid or supportive nutrients consumed consistently across meals, days, weeks, and seasons overall. This means simply eating calcium-rich foods may not fully protect bones unless absorption factors are addressed carefully with age, digestion, timing, balance, monitoring, guidance. Excess calcium taken improperly can also cause problems, including kidney stones or vascular calcification, particularly when taken without medical guidance after 60 over long periods. This is why doctors emphasize balance rather than megadoses when recommending calcium intake for seniors to support bones, kidneys, arteries, muscles, nerves, safety, longevity overall. Calcium works best when spread across meals, improving absorption and reducing strain on kidneys compared to large single doses taken suddenly, daily, alone, without balance. Weight-bearing activity combined with adequate calcium signals bones to maintain strength rather than continuing age-related breakdown during normal movement, standing, walking, stairs, lifting. Many seniors fear calcium because of outdated headlines, but deficiency poses greater risk to independence than responsible intake after 60 over years, decades, combined effects. Doctors assess calcium status alongside bone density, symptoms, and dietary patterns, rather than relying on supplements alone to guide safe, personalized decisions for aging bodies. Calcium supports posture and spinal integrity, helping seniors remain upright, confident, and less prone to compression fractures during aging, daily activity, movement, balance, stability, life. Low calcium intake often coexists with low protein and vitamin D, compounding weakness across multiple systems including bones, muscles, nerves, balance, immunity, resilience, recovery, safety. Correcting calcium intake gradually allows the body to adapt safely without sudden metabolic stress, especially in seniors after 60 with medications, sensitivities, conditions, risks present. Doctors prioritize calcium because fractures often mark the turning point between independence and long-term disability for seniors, families, caregivers, healthcare, systems, outcomes, stability, quality. That is why calcium remains a foundational mineral for reinforcing bone structure and preserving mobility after 60 throughout aging, daily life, confidence, independence, safety, longevity. Number 7, magnesium. Improves sleep and regulates blood pressure. Magnesium becomes increasingly important after 60 because it supports nerve relaxation, muscle function, healthy sleep patterns, and stable blood pressure control throughout the aging body. As people age, magnesium intake often declines due to reduced appetite, limited food variety, and lower absorption efficiency within the digestive system. Many seniors experience poor sleep not from insomnia alone, but from low magnesium affecting the nervous system's ability to relax at night. Magnesium helps regulate neurotransmitters that calm the brain, making it easier to fall asleep and stay asleep without frequent nighttime awakenings. Low magnesium is commonly linked to restless legs, nighttime muscle cramps, and shallow sleep that leaves seniors tired the next morning. This mineral also plays a critical role in blood vessel relaxation, helping maintain healthy blood pressure and steady circulation after 60. Without enough magnesium, blood vessels may remain slightly constricted, contributing to higher blood pressure and increased cardiovascular strain over time. Doctors often see seniors with stubborn blood pressure issues despite medication, later discovering underlying magnesium deficiency, contributing to poor control. Magnesium works alongside potassium and sodium to maintain proper fluid balance and electrical signaling in the heart and muscles. Deficiency can cause palpitations, muscle twitching, and subtle anxiety that many seniors mistake for stress or aging. Certain medications commonly used after 60, including diuretics and acid blockers, further deplete magnesium stores gradually. This depletion happens quietly, often without clear symptoms until sleep quality or blood pressure begins worsening noticeably. Magnesium also supports insulin sensitivity, helping stabilize blood sugar levels that otherwise disrupt sleep and energy overnight. Adequate magnesium intake may reduce nighttime awakenings caused by blood pressure fluctuations or muscle discomfort. Doctors often recommend magnesium as a foundational nutrient before escalating sleep medications or blood pressure adjustments. The form and timing of magnesium matter, as some types support sleep better while others primarily aid digestion. Taken consistently, magnesium helps the nervous system shift into a calmer nighttime state more naturally. Improved sleep quality often leads to better daytime energy, balance, and cognitive clarity in older adults. Magnesium does not replace medical treatment, but it supports the biological foundation medications rely on to work effectively. That is why magnesium is one of the most overlooked yet essential minerals for sleep quality and blood pressure regulation after 60. Number 8. Vitamin A protects vision and skin health. Vitamin A becomes especially important after 60 because it supports eye health, night vision, immune defenses, and the integrity of aging skin tissues. As seniors age, the eyes adapt more slowly to darkness, and low vitamin A can quietly worsen night vision and glare sensitivity. Vitamin A plays a key role in maintaining the retina, helping convert light into signals the brain can interpret clearly. Deficiency may cause dry eyes, blurred vision, or difficulty seeing in low light, often mistaken for unavoidable age-related decline. Doctors often see seniors struggling with vision changes that improve once vitamin A status is corrected safely and appropriately. Vitamin A also supports skin renewal, helping aging skin repair itself and maintain a stronger protective barrier. Low levels can contribute to dry, fragile skin that bruises easily and heals more slowly after minor injuries. This nutrient is essential for immune function, helping skin and mucosal surfaces block infections more effectively. After 60, immune defenses weaken, making vitamin A more important for everyday protection against illness. Many seniors avoid vitamin A-rich foods due to appetite changes or digestive sensitivity, increasing deficiency risk over time. Certain medications and chronic conditions can also interfere with vitamin A absorption and metabolism in older adults. Vitamin A must be balanced carefully because excess intake can be harmful if taken improperly as supplements. Doctors emphasize food-based sources first, such as colorful vegetables and animal-derived retinol, for safer intake. Adequate vitamin A helps maintain clearer vision, healthier skin, and stronger first-line immune defenses. It also supports wound healing by promoting proper cell growth and tissue repair processes. Low vitamin A can subtly reduce quality of life by affecting comfort, confidence, and visual safety. Because symptoms develop gradually, many seniors remain unaware of deficiency for years. Doctors assess vitamin A carefully, especially in seniors with vision complaints or recurring skin issues. Balanced vitamin A intake supports aging gracefully without unnecessary risk from excess supplementation. That is why vitamin A remains an important but often misunderstood nutrient for protecting vision and skin health after 60. Number 9. Zinc aids immunity and wound repair. Zinc becomes increasingly important after 60 because it supports immune response, wound healing, taste perception, and cellular repair that protect seniors from infections daily effectively. As people age, zinc absorption declines, while dietary intake often drops due to smaller appetites, medication effects, and reduced consumption of protein-rich foods regularly. Zinc is essential for immune cells to multiply, communicate, and attack pathogens efficiently, making deficiency especially dangerous for seniors after 60 during everyday exposure periods. Low zinc levels are linked to frequent infections, slower recovery, and prolonged illness that can drain strength and independence in older adults over long time. Zinc also plays a critical role in wound repair by supporting collagen formation, cell division, and tissue regeneration following injury or surgery in aging bodies. Seniors with low zinc may notice cuts, bruises, or pressure sores healing slowly, increasing infection risk and medical complications during routine daily living activities periods. Zinc supports taste and smell receptors, and deficiency can reduce appetite, leading to further nutrient shortfalls and unintended weight loss among older adults over time. Poor taste perception often pushes seniors toward salty or sugary foods, worsening blood pressure, blood sugar control, and overall nutritional balance with aging bodies gradually. Zinc also contributes to vision health by supporting retinal function and protecting eyes from oxidative stress-related damage that accumulates with age over many years. After 60, chronic inflammation and stress increase zinc requirements, making marginal intake insufficient for optimal immune resilience in older adults facing daily environmental challenges routinely. Certain medications, including diuretics and acid suppressors, can increase zinc loss or reduce absorption in seniors over extended treatment periods, without obvious warning signs appearing. Alcohol intake and chronic digestive conditions further raise zinc deficiency risk by impairing absorption and increasing excretion within the aging gastrointestinal system over time gradually. Doctors often test zinc status when seniors experience recurrent infections, poor healing, or unexplained changes in taste perception affecting appetite, nutrition, energy, immunity, safety overall. Balanced zinc intake helps shorten illness duration, strengthen immune response, and support faster recovery from everyday health challenges faced by older adults during aging years. Food sources like meat, seafood, dairy, and legumes provide zinc alongside protein that improves absorption efficiency and supports muscle immune repair processes in seniors daily. Supplemental zinc should be used carefully because excessive intake can interfere with copper balance and immune function in older adults when taken improperly long-term. Doctors emphasize moderate, consistent zinc intake rather than high doses to support long-term immune stability and reduce deficiency-related complications during aging years safely. Correcting zinc deficiency often improves appetite, healing speed, and resistance to infections over several months in seniors who previously struggled with frequent illness cycles repeatedly. Because symptoms are subtle, zinc deficiency is frequently overlooked until immune problems become persistent and begin affecting daily functioning independence, confidence, safety, health outcomes significantly. That is why zinc remains a vital mineral for immunity and wound repair in adults over 60, supporting recovery, resilience, independence, and long-term health. Before we close, I want to leave you with one personal reminder that many seniors find reassuring and empowering. After 60, feeling weaker or more tired does not mean your body is failing, but often that it is missing specific support it can no longer obtain easily. Instead of guessing or taking everything at once, focus on understanding what your body actually needs now, not what worked decades ago. Small, well-timed nutritional changes can quietly restore strength, clarity, and confidence without overwhelming your system. Approach this stage of life with curiosity rather than fear, and let informed choices guide you towards steadier, healthier days ahead. As we've seen, nutrient deficiencies after 60 are rarely dramatic, but their quiet effects slowly shape strength, balance, immunity, memory, and overall independence every single day. Aging does not suddenly strip the body of nutrients. It changes how efficiently they are absorbed, used, and distributed to the organs that need them most. This is why many seniors feel unwell despite eating reasonably and taking supplements faithfully, yet still miss what their cells actually require. The goal after 60 is not chasing more pills, higher doses, or trendy supplements promising fast results without understanding real biological needs. True health comes from identifying the specific vitamins and minerals your aging body struggles to maintain consistently. When deficiencies are corrected thoughtfully, many seniors notice better energy, steadier walking, clearer thinking, improved sleep, and stronger immune resilience over time. These improvements often feel subtle at first, but they compound into meaningful quality of life changes across months and years. Supporting nutrition is not about fighting age, but about reducing unnecessary strain on systems already working harder than they once did. Small targeted adjustments often outperform aggressive supplementation strategies that ignore absorption, timing, and individual tolerance. Listening to your body's signals matters more than following generic advice or comparing yourself to others your age. Every senior's nutrient needs are shaped by diet, medications, digestion, activity level, and personal health history. Understanding this helps transform nutrition from confusion into a practical tool for maintaining independence longer. Health after 60 is built through awareness, consistency, and respect for how the body truly changes. You are not broken because you feel tired, weak, or unsteady. Your body may simply be missing essential support. Correcting deficiencies is one of the safest ways to protect bones, nerves, muscles, heart, and brain without extreme interventions. Progress does not require perfection, only informed, steady care aligned with your real needs. If this information resonated with you, reflect on which nutrients might deserve closer attention in your daily routine. Share this video with someone over 60 who may be struggling silently with unexplained symptoms. Comment below with your age and which nutrient surprised you most today, so we can learn from each other together. And remember, after 60, health improves not by doing more, but by doing what truly supports the body wisely.